Welcome to the latest edition of Oncology Updates, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest, the FDA granted Fast Track to AVZ0103, a Nectin-4 and Trop-2 bispecific antibody-drug conjugate, for adults with locally advanced or metastatic urothelial cancer previously treated with enfortumab vedotin. This targets a post-enfortumab setting with no approved ADCs. Swissmedic approved lurbinectedin plus atezolizumab as first-line maintenance for extensive-stage small cell lung cancer without CNS metastases after induction with atezolizumab, carboplatin etoposide. IMforte reduced risk of progression or death by 46% and death by 27% versus atezolizumab alone. Median overall survival 13.2 versus 10.6 months, and progression-free survival 5.4 versus 2.1 months, with safety consistent. Imfinzi, durvalumab plus FLOT, was approved as the first perioperative immunotherapy for resectable stage 2 to 4A gastric and gastroesophageal junction cancers. Matterhorn showed event-free survival HR 0.71 and overall survival HR 0.78 versus FLOT benefits regardless of PD-L1, with similar rates of grade 3 or higher adverse events. Sequence: neoadjuvant Imfinzi with FLOT, adjuvant Imfinzi with FLOT, then Imfinzi monotherapy. Phase 2 monotherapy of sacituzumab tirumotecan at 5 mg per kilogram every 2 weeks in metastatic urothelial cancer after chemotherapy and checkpoint inhibitors. Among 49 patients, confirmed objective response rate was 31% overall, 50% in second line, disease control rate 71%, median progression-free survival 5.5 months, and median duration of response not reached with a 53% probability of sustained response at 12 months. Safety was manageable, mainly hematologic toxicities and stomatitis, no febrile neutropenia, and no grade 5 treatment-related adverse events. Astrin Biosciences launched Certitude Breast, a non-imaging blood-based early detection test using deep proteomics and artificial intelligence. In a study of 1,242 women, sensitivity was 92% and specificity 93% across stages and subtypes, with negative predictive value greater than 99.9%. Positioned as a supplemental option, especially for women with dense breasts where imaging has limitations and higher false positive rates. The NCI and SWOG S1609 DART basket trial tested nivolumab 240 mg every 2 weeks plus ipilimumab 1 mg per kilogram every 6 weeks in rare cancers, allowing prior anti-PD-1 or PD-L1 therapy. Clinical benefit rate was 26% in both those with and without prior exposure, with no significant differences in progression, free survival, multivariable hazard ratio, 1.18 with 95%, confidence interval 0.83 to 1.68, or overall survival hazard ratio 1.11 with 95% confidence interval 0.76 to 1.63. The FDA cleared a trial of FOLR1 CAR T for relapsed or refractory osteosarcoma, NCT 072275571, enrolling ages 1 to 75. First used in infants with CBF or GLIS acute myeloid leukemia, the platform may expand to other FOLR1 positive malignancies based on expression and preclinical efficacy. An investigator-sponsored Phase 2 at MD Anderson added the CD47 blocker evorpacept to rituximab and lenalidomide in previously untreated indolent B-cell NHL, follicular and marginal zone. In 24 patients, complete responses were 92% and partial responses 8%, overall response rate 100%. 1-year progression-free survival was 91%, and 1-year overall survival 100%. Well tolerated in a frontline, non-chemotherapy setting. Stay ahead in oncology research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@